guys, this is going to be your lower extremity. I think I might just do this on the pelvic girdle and then have a separate video for the rest. Let's look at the pelvic girdle. So starting on page 69 of your lab manual, where there's the pelvic girdle consists of two os coxae. So the bone that we refer to as the hip bone has several names. So it's known as the coxal bone. Here it's known as also the os coxae or hip bone. When you answer this on the test, I want you to use either the coxal bone or os coxa. So we have two coxal bones, and those os coxa are going to be the result of the fusion of three bones. So this hip bone or coxal bone, right, is actually the fusion of three separate bones. So we can see them color-coded here. The upper part, that's going to be the ilium, I-L, oops, I guess the I was made capital, I-L-I-U-M. Then we have the anterior portion in pink here called the pubis. And then we have the purple part called the ischium. Okay, so those three bones fuse, and so each bone is going to be listed separately, and they have their own separate landmarks, but really it's just the one coxal bone. So if I ask you, and if you see an image of this bone and I ask you what it is, it's the coxal bone. So going back to this pelvic girdle, you can see the pelvic girdle is two of these coxal bones. The bones of the pelvic girdle are very massive than the bones of the pectoral girdle, right? So the pectoral girdle, remember, is your shoulder joint. These are your hip joints. Because your hip joints obviously are going to support the weight of your entire body, the torso, and it's going to be a little bit less flexible because the deep fossa here, which is called the acetabulum, is where the femur, the head of the femur, will articulate. And that's a better fit. So a better fit of bones equals more stability. Although the sacrum and coccyx compose the pelvis, so we have the sacrum here and we have the coccyx here, they're also in this pelvic girdle. They're not technically part of the pelvic girdle because they're technically part of the axial skeleton. So just a bit of a technical issue there. Also note that between the two coxal bones in the anterior, we have a joint. That joint is called the pubic symphysis. So the pubic symphysis is this cartilage. Remember that this is a piece of fibrocartilage, and that is to create that joint in the anterior between our two pubis bones. All right, so let's take a look at the bones separately, well, one piece at a time. So one thing to notice is that one side of the coxal bones contains that really big depression, and then the other side does not. So this is going to be facing externally. So this, obviously this opening here is where the head of your femur will articulate. So it's going to face the lateral aspect of your body. So it's facing, so this is more of a lateral view of the bone. And then this view, letter C, is going to be the view from the inside or more medial view. So we don't have that really big depression on this side, and we can see pictured here, there's kind of a depression in this region. So this is called the iliac fossa. And in your body, there's a muscle called the iliacus that rests in this iliac fossa. So this is the more medial part of the bone. So if we take a look at this, right, we can see that here is our iliac fossa, that nice big depression, and that's where the iliacus muscle will rest. So notice how it faces internally towards your organs, and then the acetabulum faces laterally. All right, let's take a look at our parts here. So let's go through the list. The ilium, so the yellowish upper region of this, the superior region, we have our iliac crest. So the iliac crest is really just everything you see, the superior border of the bone. And you can maybe feel your iliac crest. If I said put your hands on your hips, you would rest your hands on the iliac crest. So the iliac fossa is next, right? So the iliac fossa is that depression where the iliacus muscle will rest. And then we have 4 spines, the anterior superior iliac spine, anterior inferior, posterior superior, and posterior inferior. So these are just little points where the ilium comes to. So we want to look at our anterior side versus our posterior side. This is the trick. When you're looking at this bone, you always want to look for this really big notch. This is your greater sciatic notch. And for some of you guys might already have the knowledge that you have a very large nerve that runs down the posterior thigh all the way down the back of your leg, the posterior leg, and that's the sciatic nerve. It's the largest nerve in your body, and it emerges from basically the lower part of your vertebral column. It runs down basically behind some muscles of your buttocks, okay? So it's going to run through this notch. So that's the greater sciatic notch. So anything that is on the same side as this notch is going to be posterior because the sciatic nerve runs behind your butt, behind your thigh, behind your leg. So that way we can really say that this is your posterior spines. And the posterior superior is just the very end of your iliac crest, right, where that ends. The posterior inferior iliac spine is just the inferior end to the flared region of the ilium. The anterior side, right, so you want to look for the side without that notch. Again, the anterior superior iliac spine is just the end of the iliac crest. And then there's another bump, right, this here, and that's your anterior inferior iliac spine. So the trick is to know when you're looking at an image of the coxal bone, what's the anterior side and what's the posterior side. And I always like to use this really nice big sciatic notch. All right, so that's the last one on the list as well. That greater sciatic notch is this notch that I use to identify the posterior side. Moving on to the ischium. Okay, so the ischium is the purple portion. There's 2 views of it. So this is the view where it's more medial, and I'm going to use the other view to look at it. But there's the purple part. So this is the bone that you're sitting on. So if you do yoga or exercise, sometimes they'll call this your sit bone, which is right here. So if you're sitting straight up in your chair, you're sitting on this really thick part of the ischium. That thick part of the ischium is called the ischial tuberosity. All right, so what is a tuberosity? A tuberosity is going to be a part of bone that is a site for muscle attachment. And the muscles, the bigger the muscles, the bigger the lump or heavier the bone will be, right? Because the bigger the muscle, the more force it will generate on the bone. Remember that bone, when it feels that mechanical stress, will actually increase in diameter, increase in width, because it's going to accommodate for that extra stress. So for those of you out there who want to know, this is the hamstring group, so the muscles on the back of your thigh. They are going to have an insertion point on the ischial tuberosity. So that's why it's so big, this really big heavy part of the ischium, because their hamstrings are a very powerful group of muscles. And another thing is when you pull your hamstrings, right? If you can pull your hamstrings a couple places, but one of the most common places is the back of your butt, right where your butt meets your thigh. And that is where you're going to find your ischial tuberosity. So sometimes the tendon will kind of detach or get weak as it attaches to the bone, and that's where you feel the pain. Anyhow, so that's your ischial tuberosity. So we talked about that. Now let's find our ischial spine. Let's go back up. So our ischial spine is this little tiny projection here, okay? So it's right after our greater sciatic notch, so our ischial spine. And then after our ischial spine, we have a curve, right? So this curved region that I'm sort of making thick with my marking pen is the lesser sciatic notch. So the sciatic nerve will curve through the greater sciatic notch and then take a turn and curve and follow the lesser sciatic notch. Then we have the ischial ramus is the last one here. So the ramus is going to be a bridge or a bar of bone. It means a branch. And rami, we already talked about the ramus of the mandible, right? So the ramus of the mandible was this like rectangular area before it went to the mandible. I'm doing a very bad job of the mandible, but something like that. That was the ramus. So the ramus here is going to be this entire bridge of bone that I'm sort of outlining. That's the ramus. And the ramus of the coxal bone is going to be cut in half, but you have to do it mentally. So we're going to do a mental half. The image here is already color-coded for you, but if you did not have a color-coded coxal bone, you have to do it mentally. The part of the ramus that is on the side of the ischium, that's called the ischial ramus, okay? And the side that is, or the half that is on the pubis bone, that is going to be the inferior pubic ramus. Why inferior? Because the pubic bone also has a superior pubic ramus, which we'll take a look at now. Why not? So this is, before we move on to the pubis, this is the sciatic nerve. So notice that this curve, right? This is the greater sciatic notch. So you can see the sciatic nerve running next to the greater sciatic notch. And then the lesser sciatic notch is right here. Okay. Sorry, it's right here. It doesn't really show it moving in that sciatic notch, but that's what it should do. Okay, actually let's go back to that picture. Let's talk about the pubis. We'll take a look at this picture for the pubis. So the pubis has a couple features. So it has a pubic crest and pubic tubercle. So the tubercle is the point. It's the very last point on the pubic bone. And then the crest is going to be this ridge that leads there. It's not labeled here, but that's the crest. The superior ramus and the inferior ramus, again, is a bridge of bone. So if we were to draw this rectangle, that's our superior pubic ramus. And then our inferior pubic ramus was, remember that area that was cut in half here. That's our inferior pubic ramus. All right. I think that's it. Okay, and then moving on to additional structures of the os coxa. We have the acetabulum with lunate surface. Okay, so I'm just going to I'm going to erase those marks. So the acetabulum is the entire depression. So I know we want to say the word fossa, but it's not. So the entire deep depression here is acetabulum. Now, if you look at acetabulum with lunate surface, the lunate surface is this raised area inside of the acetabulum, right? I'm going to color it in. That is actually shaped like a moon, right? Because lunate needs moon. I think it looks more like a croissant, but that's the raised surface within the acetabulum. So that's why you have acetabulum with lunate surface. Now, we do have an acetabular fossa, and that's going to be here, right? Because it goes down a little bit more in that deeper depression within the acetabulum. That's the acetabular fossa. The last term is obturator foramen, which is the only foramen I see, right? Which is that opening here. Now, you might think that something large goes through that opening, but in fact, nothing large goes through that opening. The obturator, there's a nerve that runs through it called the obturator nerve that we'll look at in the nervous system, but that is the obturator foramen. So now let's look at features of the entire pelvis. All right, so when we take a look at the pelvis, where there's features of it that people use to identify male and female pelvis. So let's take a look at these features. Let's start with the inlet and outlet. That might be the easier things to start with. So the inlet is, I'm just going to make this bigger. So imagine if you had this in your hand. You can run your fingers in this direction around this rim, right? So this is going to be the inlet. This is known as the pelvic brim or the inlet, because this is childbirth term. So as the baby is getting born, right, the baby's head is going to move through the mother's pelvis. So these are imaginary planes, right? So the baby's head will move through the inlet into the lesser pelvis. So now let's talk about these terms, greater pelvis and lesser pelvis. So I like greater and lesser because greater to me just means bigger. So if I were to make an imaginary line going across from my iliac crest to iliac crest, and that space all the way to my inlet, that's going to be my greater pelvis. It's just a bigger space that is formed by my bones, okay? When the baby's head goes past the brim, then the baby's head is going to be in a smaller space. That's called the outlet. That's called the lesser pelvis. So the space that occupies, so this is the end of my pelvis, right? The space that occupies between my inlet and my outlet, that's called the lesser pelvis. Okay, so let's look at this another way. Let me just minimize this. All right, so this is, let's look at the side view, all right? So again, this likes to use false and true, which is fine. You can memorize false and true. But again, I think false and true just doesn't describe it as good as greater and lesser. Okay, because greater is bigger. So the space, this is a space. The space that occupies the upper part of my coxal bones is the greater pelvis. The imaginary line that I said you run your finger around, that is going to create the pelvic brim or the inlet. That's going to be here, right? So that's an imaginary line or a plane. So as the baby's head moves down, it will first occupy the greater pelvis. It will then pass through the pelvic brim or inlet and then enter into the lesser pelvis. So the lesser pelvis is what's colored in purple here. And then there is an outlet. And the outlet, again, is an imaginary plane that is going to basically delineate what's the end of my pelvis. And the baby's head will then exit the lesser pelvis by breaking that pelvic outlet plane. Okay? So once again, we can look at it from a different view. So we can see the outlet is this dotted line that kind of draws for you that imaginary barrier that the baby's head passes through. So I kind of like to make the analogy of like a touchdown in football. So all you need to do is bring the football past that plane of where the end mark is on the football field, right, to the end zone. So as long as that football just passes through that plane, you get a touchdown. So that plane is kind of like the inlet and outlet. It's this line, right, that sort of says, here's the beginning of my lesser pelvis, here's the end of my lesser pelvis. So let's see. So hopefully this picture now makes a little bit more sense, right? So let's go through it one more time. So the greater, right, remember this is the greater. The bigger space is going to run from iliac crest to iliac crest, and it's going to occupy all of this upper part of my pelvis. When I pass through the inlet or my brim, then I'm going to enter into the lesser pelvis, the smaller space, which is shaded in for you. How do I get out of the pelvis? I have to pass through the outlet. And the outlet is that imaginary plane, again, right? That sort of signifies this is the end of my pelvis. So hopefully that makes sense to you. The last term on the list is a pubic arch. And the pubic arch is easy to point out. It is this arch right here that is formed, that I'm drawing in red, on the inferior surface. And it is the greatest way to look at the difference between male and female. So let's take a look at that. So for the exam, you should know the differences between male and female pelvis. The most obvious is going to be that pubic arch. Look at this the upper image pubic arch. Notice how this angle is less than 90 degrees, so it's an acute angle. Okay, and look at the other, so we'll call this pelvis 1, we'll call this pelvis 2. Look at pelvis 2's pubic arch. Look how wide and broad it is, right? This is an obtuse angle. It's bigger than 90 degrees. So, if you haven't guessed already, the narrower pubic arch is a male pelvis, and the wider pubic arch is a female pelvis. There are other features also. So if you look at this chart, you can see that there are differences between male and female pelvis. A couple things that also stand out to me is just the brim or the inlet. Remember, look at the circle I can make on the male pelvis and the wider circle I can make on the female pelvis, right? So obviously female pelvises are designed for childbirth, and so they're going to be wider and more accommodating to having a baby move through. The outlet is also wider on the female and narrower on the male, and the best way to look at that is this picture. So this one down here. Take a look at the female. Look how large the outlet is, right? Just the space that the bones provide, that plane. And then the male is much narrower, right? So a baby can't really fit through there that well. In terms of the sacrum and coccyx, right, the female is a little bit more posteriorly oriented, and the males are a little bit more less movable, they're narrower, and it curves ventrally, so it curves towards the front. So those are features, obviously, again, for females to accommodate childbirth. All right, so that'll be the end for this lecture.